course, is at OSF St. Mary and Holy Family right here in Monmouth. Hi, Lisa.
Good morning.
Good to see you. How are you?
Good to see you, Vanessa. Doing very well. Thank you.
This was a really good year for OSF with a lot of investment, capital investment back into the entire organization from Peoria here to Galesburg and into Monmouth.
Yeah, absolutely. It really was a very, very busy, but very just great year. Lots of progress and lots of updates. And, of course, when we think of, 2024 for OSF as a healthcare system, the Cancer Institute certainly comes to mind. So, really with completing the construction of the OSF HealthCare Cancer Institute in Peoria and that opening in February, to really launch OSF full on into providing that really state-of-the-art progressive cancer care across the state of Illinois and beyond. And we certainly are beginning to feel that outreach already into Galesburg and certainly into Monmouth, and that will just continue on in the next few years. So that's really, I would say our kind of monumental moment within OSF as far as continuing to expand services we're providing.
What makes OSF stand out with this type of cancer care?
Yeah, the Cancer Institute, first and foremost, really was built around the opportunity to bring in the proton beam, which is really, there are not many of those across the country, and to have one positioned in the state of Illinois, that is really best-in-class, state-of-the-art opportunity for our patients to not have to travel so far to receive those types of services. So really it was built around that, and then certainly full-on, medical oncology, radiation oncology, all of the supportive services to really wrap ourselves around the patients and throughout their entire cancer journey. Also a very large-scale focus in clinical research and trials to bring the latest to our communities and really offer up opportunities that, would really require patients to travel across the country to receive some of those, and really beginning to provide that right now out of Peoria.
Okay. And then into Galesburg as well. And you're seeing patients from Galesburg, Monmouth, and the surrounding areas.
Absolutely. And so, as far as Galesburg, we are full on in design right now of the St. Mary's Cancer Center. And that really will be a full-on extension of the OSF Cancer Institute out of Peoria. And what I mean by that is radiation oncology, medical oncology, all of the support services brought to our rural communities here. We will have, the state-of-the-art radiation therapy services, be able to provide the medical oncology services as well. And then really what I'm really excited about also is the opportunity to do that clinical research and those trials that's really focused on those cancers that really impact our rural communities. And so really to become kind of a rural hub of sorts for a very large region, well beyond Galesburg, Monmouth, our primary secondary markets, to serve rural communities. And what that does for our patients is bring them best in class and not require the travel. Really, when you think about the barrier for transportation, travel, time, the expense, and just, most importantly, the experience for our patients when they're ill, not feeling well, to have to travel for those, radiation therapy treatments, which may be 4 to 5 times a week, when they're receiving their chemo and their infusions, to not be feeling well and have to travel. And then navigate those larger areas. And so we are really committed to that project, and there'll be much more coming soon to talk about what that looks like, what it's going to take to make that happen for our communities. But OSF is certainly committed to bringing cancer care to our rural communities.
Okay. Now, the collaboration with Monmouth College throughout the year with the students being able to complete a bachelor's degree, a 3+1 nursing program, it's been out since May.
Yes.
We're ready. Are we ready to kick this off? Because technically that would be this fall.
Yeah, so that actually has kicked off. So those first sets of students have already entered that program here in 2024, fall of 2024. So very exciting. That really, to me, was probably one of the most joyful moments in 2024, was to really see that come to fruition, to really bring together the best of Monmouth College and OSF. And when you bring those two institutions together, committed to educating and training up nurses to provide care to our communities. That's what we call a pipeline. That's the future, right? A part of our future in nursing care across the rural communities is to really to show the opportunity to serve in that way and serve our communities in that way. But then to do it collaboratively with an institution like Monmouth College, that's going to be bringing best-in-class, nursing care to our communities and offering that opportunity to local students who want to stay close to home but have that college campus experience, and then bring the best of OSF with the College of Nursing program. Super excited about that collaboration. So we'll begin those clinical rotations for those nursing students here in about 3 years. But right now they're doing their undergrad portion, that getting their bachelor's, doing their undergrad and completing their bachelor's there that first 3 years, and then we'll complete the BSN portion in year 4.
Okay. Also, this was a big year for new providers. Let's talk about the new providers at OSF.
Yeah, so we've really been adding to our team. So we have Carolyn Boatfield, who's now coming to the Monmouth Rural Health Clinic. We have Dr. Dionisio, who's starting here this month as well, new physician in the Monmouth Rural Health Clinic. Katie Ringberg, she's been an excellent addition to the team here in Monmouth at the clinic as well. And we also are getting ready to welcome Dr. Matt Heberer to our general surgery team that serves Galesburg and Monmouth. He will be joining us here after the first of the year as our 4th general surgeon here in the Galesburg-Monmouth market, and we actually will be welcoming number 5 come August as well. So we have another local physician returning, and that announcement will be coming soon, but he'll be joining us in August of 2025. So really building that surgery team strong to support this region, and they're just excellent caliber and great team working well together. And so lots of exciting things happening as we continue to support those services across both Galesburg and Monmouth.
Okay, terrific. Also, we talked last month about some pretty impressive awards.
Yes, yeah, really continuing to celebrate our mission partners at Holy Family Medical Center, and really just our continued commitment to excellence in care and keeping patients local here in Monmouth at Holy Family Medical Center. We had achieved the 5-star rating for the National Rural Rating System, and so that was very exciting to celebrate that with our mission partners, and that really shows their commitment to quality and experience. They are real rock stars when it comes to patient experience. They were they finished top, number 1 in the OSF HealthCare system for their patient experience ratings, as well as their mission partner. We call all of our employees mission partners, and our mission partner engagement scores. So we do an employee survey annually, and Holy Family Medical Center just was off the charts, highly engaged, and really did great in that process as well, and just really reflects what we feel and what we know at Holy Family Medical Center. And that is just, there's just such a high energy and level of engagement from our mission partners there. They love what they do. They know their why. They are very excited about the growth we've seen at Holy Family and keeping patients local for their care. We have really grown what we call our inpatient census, and that means we are keeping patients local for their hospital care, so that acute care on our inpatient floor and skilled stays. We've tripled that volume over this year and last few years in 2024, and we're expanding our staffing to keep even more patients local, and so very committed to that and continued growth in all of our diagnostic services. We've seen a great increase in volume across that, as well as our surgery volume at Holy Family. So they're incredible. I could not be more proud of this team and their commitment to all that growth, and we're going to keep on going.
Okay. Also, the OSF Life Flight, we have firsthand experience with that, or actually our beloved, wonderful sports director, Sean.
Yes.
And so we're so thankful that our rural community has a Life Flight operation.
Yes, we are so blessed. We just celebrated the 40-year anniversary of OSF Life Flight. It's a program near and dear to my heart. I just think it's an amazing team. It's such an important service for rural communities to get care timely and get where they need to be in times of medical crisis or critical life events. And so we are very blessed to have a hangar in Galesburg on the St. Mary campus that serves this entire region for timely response. So we have helicopters positioned 24/7, 365 here in this market. And so that means timelier response for those transfers, and also out to the field. They respond to the field. If there is a traumatic event or accident, injury in the field, they can also respond to the field and get the patient out quickly. So great team, great collaboration, and we're very blessed to have that service in our rural areas.
You got it. Okay, the future. What's on the horizon for you guys?
Oh, a lot. We are lots of exciting things happening. So we already talked about the Cancer Center, and certainly, we really, I want to call out the great work that's been done across the Galesburg and Monmouth teams with regard to just the synergy. We really look at St. Mary's and Holy Family as sister hospitals, right patients, right location, to really meet the needs of our patient and keep them local in our rural areas. So that continued growth of what we call our hub and spoke model with Holy Family and St. Mary's, the teams work beautifully together. A lot of the same teams stretching across both campuses to really build that culture and energy around keeping patients right location. When you think about oncology services and, the serving the entire market through oncology services, we have a new surgical oncologist who her focus, Dr. Floyd, she's amazing. She is now seeing patients in our market as well for surgical oncology, so patients who require surgical intervention for their oncology, their cancer journey. Dr. Floyd is now seeing patients in the market for that as well. We will continue that outreach much deeper for oncology services into Galesburg and Monmouth here in the future. We also have the construction project that we are in full-on design for at Holy Family, and that is to build the new Center for Outpatient Services, which is really to relocate all of our diagnostic services, so lab, imaging, as well as our outpatient services such as cardiopulmonary testing, all of those services to be centrally located off of a brand new main entrance, expanded parking, registration centered right there for all of those services so that patients are easing their way into and out of the building and receiving all of those services. Brand new laboratory is a part of that as well. So lots more coming. We're getting ready to place our new CT. We're upgrading our CT scanner at Holy Family, so that is underway, and we're getting ready to plan for bringing in the new CT scanner. We're going to be bringing more diagnostic imaging services over and positioning those at Holy Family to serve the market. So Holy Family is absolutely just a key player and just a facility I'm incredibly proud of. That's really serving our markets well and just is a key player in this whole regional market approach to healthcare, the ecosystem here across Galesburg and Monmouth.
Boy, it's really amazing the amount of infrastructure improvements. Yes. I call them infrastructure because of how the hospital is laid out.
Yes.
And those are going to be very, very good.
Yes.
Good for you under your leadership, Lisa, that you're able to do these capital improvements.
Yeah, we're fully committed. Again, we are really blessed here in this region with the opportunity to have the ecosystem of our two facilities, right services, right locations, to have more robust ecosystem for healthcare for our communities. And I am really blessed to have the opportunity. I always say I have the best of both worlds, and this is really the heart work, to see this continued growth. When you see all of the rural hospital closures that are happening, across the state and across the nation, to see the growth and the progressiveness and the full-on commitment and the energy around the ecosystem between St. Mary Medical Center, Holy Family Medical Center, to ensure long-term sustainability of high-quality progressive health care for our communities. We are all in, and we will be here for a long time to come and very highly committed to that. And so the energy here is really unique, and it's really special when you really truly understand what's happening elsewhere across the country. And so we're incredibly blessed, and I'm just blessed to be a part of it.
Okay. And illnesses, boy, those are rampant.
Oh, boy. Yeah, we're really seeing the ramp up. So unfortunately, always seems to align with the holiday season, but we're seeing a big ramp up right now in respiratory illnesses, gastrointestinal. And so really seeing an uptick in patients reaching out for services. A reminder, we have same-day appointments available in our clinics. Please do not hesitate to call for a same-day appointment. We also have urgent care and prompt care services available across Galesburg and Monmouth. So please call your clinics. Please, prompt care, urgent care services. We also have virtual visits available through OSF On Call. So if you just don't feel well enough to even go out to the clinic, you can certainly jump online and do a virtual visit from the comfort of your home. And please, for those illnesses, we ask that you seek those locations. The emergency departments are very full right now with unfortunately, this is also the time of the year where we do tend to see the uptick in those heart attacks and strokes and really critical events for patients as well. So the emergency departments are very busy. And so we really ask that everyone please try to reach out to those clinic, prompt care, urgent care locations to preserve the emergency departments for those really critical needs. But again, we're here for you. If that's the best option for you, we certainly are there to serve you as well.
Okay. I hope you and everyone at OSF has a wonderful holiday.
Yes, you as well, and safe travels. And
Thank you.
I hope you have a very Merry Christmas.
Merry Christmas to you as well.
Thank you so much.
Lisa DeKezel with us, president of OSF Holy Family and OSF St. Mary on WRAM.